Thanks, Concorla. Well, I listened before lunch to Deputy Buttimer berate the House and the opposition for the fact that there were no opposition members present when he was giving us his deliberations, and I think it's somewhat striking that obviously there are no government representatives here now either, and it is a bit of a ridiculous point to make, given the fact that in many ways what's happening in our health service and the future of that service is being dictated outside of here rather than inside here. And I make reference to the fact that today we have the very first ever GP protest outside the doors of this House because doctors, ordinary doctors, feel they haven't got the wherewithal to continue, and many new entrants to the profession are being forced to leave these shores because they simply cannot make ends meet. And we've listened to them on the radios this morning talk about the enormous reduction in income to their practices. So we have to see this yet another bill in relation to the health services in the context of the overall situation with our health service, which I think it is not unfair to characterise really as a bit of a shambles. We had the recent appointment of Minister Varadkar, who, if you like, verified what we all knew anyway about the ridiculous universal health insurance proposal that the government had put forward, lying in effect tatters. And we need to, as we're putting nearly once a week, we're having some sort of health service amendment bill in the House. And I think we have to start by saying, is this really the best way forward, this patchwork quilt of changes onto a dysfunctional health service? And really, would we not be better off stepping back and looking at the whole proposition? And sadly, in terms of an Irish context, Irish people have never had access to a universal healthcare system. We rely on a procedure whereby we have a means-tested medical card giving access to public state-funded care, or if you don't meet that means test, you can opt to apply for private health insurance, or else you can just take your chances and not do anything. Obviously, originally, when the VHI was set up, it was set up as a semi-state body with the Minister for Health as the sole shareholder, and really, in the absence of proper state-funded healthcare, it was supposed to provide affordable health insurance, subsidised through income tax relief for those who wouldn't be qualifying for a medical card. But instead we have this sort of hybrid situation which is actually in tatters, because in terms of private health insurance, while it may mean faster access to care facilities, in fact waiting lists are still a problem there. And the reason for that is the fact that the number of inpatient beds have been cut by over 5,000 since 1981, and this hasn't been compensated for by the increase in day places. So, if you like, cuts in public beds have led to growing inequalities of access and waiting lists and all of the other problems that were highlighted earlier in the debate. And we do have, in living terms, an Irish apartheid in terms of our health system. And I think really the idea of universal healthcare and all the other big grandiose proposals that were kite-flied or whatever really reflect an influence from the private health market and the globalised private health insurance, allegedly promoting competition, but in effect trying to bring in an Americanised health model into Europe, which is not something that I think people want. And we do have to look at any changes we make in the context that in Ireland now, in terms of European averages, we are way behind in terms of basic health care. Ireland has earlier mortalities, a higher burden of chronic long-term illnesses, poorer outcomes and survival rates, and so on. So I think we have to look at this legislation very much in the context of that background, and I don't agree with the sort of piecemeal approach. Obviously, in an overall sense, raising standards of health and care professionals is a very good thing, and the idea of including opticians, for example, in that is a laudable objective. But I think we'd be very one-sided if we looked at that addition to that profession being covered by Corru and didn't look at the actual experience of how Corru has been working already, because there really is no point in adding in a new profession if the very body that's supposed to be regulating it isn't really working all that well. And I think I would like to look at that a little bit, because I think the addition of opticians per se in some ways is neither here nor there. I mean, obviously the opticians themselves have made the point, which has been articulated already, that it is a little bit excessive that the new registration would require all staff to be registered with Corru, including non-clinical staff. That does seem to be over the top. They're not involved in medical procedures, they're not involved in giving medical advice, and in that sense they shouldn't be included under that. So that's the good. Well, that they will be reassured by that, but it doesn't get us away from the bigger picture, if you like, that, well, okay, being included in Corru, what does this mean? And have we really created a myth that this is a professional standard which the professions are being asked to sign into, and it means that everything is going great? Or is it just a sort of a fig leaf and everything really isn't going great? And how do we really improve the standards? Because simply bringing a profession under the scrutiny of Corru isn't automatically going to do that. And I want to use the example of social workers really to illustrate that point, because, you know, we have a scenario whereby there is a crisis of social workers at the moment. Everybody is aware of the tragic reports of thousands of children waiting to be assigned a social worker because of the shortage. And yet we have a scenario where less than 3,700 social workers have signed up to register with Corru. Hundreds of those people have not been actually approved. And we have actually the minister earlier in the year, not this minister, the new minister for children, in a health committee briefing told us he would give us a report on these figures, but there is a differential there, and we've been led to believe by social workers who are operating that some people are being paid by the HSE and haven't actually been approved or registered by Corru, yet at the same time those social workers themselves who have qualified are struggling to come up with the fees. And I think we need to look at that, because how can the professions conform to a standard if that standard is being implemented against the backdrop of vicious cuts in health budgets? Is it the case that then the professions are going to be scapegoated for not really being able to meet the standards that is being expected of them? I mean, they have to pay a fee, and it's to Corru, and they don't actually get any representation or anything like that if something goes wrong. Obviously, the points have been made previously about these fees being applicable to students and the unemployed who registered with Corru before they qualified. We had scenarios of, say, unemployed social workers not being accepted for interview unless they had registered with Corru, which at the time was a fee of about €350. About 10 times the amount is being charged in Britain, although obviously it has been reduced in that period now. So where is the analysis that Corru is working to raise standards, and how can you raise standards against the overall backdrop of cuts? And I want to use the example of midwives, really, who's the Nurses and Midwives Act was meant to provide an efficient, transparent and accountable regulatory system, in effect good governance. Now, who's going to get up and argue against good governance? Nobody. Obviously that is an objective that we would strive towards. However, those at the coalface, the nurses and midwives themselves, made the point that Section 40, which went through as part of that, really has led to very serious problems and incursions into the professional autonomy of midwives, which I think absolutely needs to be examined, because as a result we've had cases of midwives being suspended and their patients being left without any appropriate care, and a belief that really what we have is sort of micromanaging, making it difficult for professional people to do their job, and if you like, threatening their professional autonomy and livelihoods because of this sort of Big Brother is watching you type scenario, which some have described as nearly, it's like an Iranian theocracy nearly, where we have sort of orthodox viewpoints being foisted on the state, almost like a state surveillance system on people trying to do their jobs. And I think we need to look at that. And what I would ask is, how will the regulatory process enable professional autonomy to be maintained, and strengthened for the professions involved, because that's critical if we're looking at really good governance, which is what we should be striving towards. And I would also ask that in harmonising this bill with other existing legislation in terms of the initial nurses and midwives legislation, how will there be a transparent process of redress for individuals as the recipients of services? How will this be built in as part of the regulatory framework? Because the people who need, if you like, protection from this are obviously the patients and the people who use the service, but also the workers and the professionals who provide the service. And we need to get the balance right, really, between the two of those. And I'm not sure, I don't have a particular problem with opticians being included in the present situation, but I do think that the debate needs to go far more than that in order to look at how we're regulating the professions, and is it reasonable to expect professionals to conform to standards against a backdrop of cutbacks, which makes it very difficult for these people to actually do their jobs? And do we set ourselves up for a scenario where they could be scapegoated? The last point I would make, Minister, is the section which relates to the amendment of the Health Act 2007 and the statutory changes for those who receive residential support services. And I'm wondering, in that sense, particularly as we operate and the whole home help area operates in the absence of proper scrutiny by HICWA and other organisations, is how are we monitoring this area? There's been horrific reports of even how many people have gone and engaged in the necessary recruitment to upskill themselves. They've availed of FETEC level 5 courses at their own expenses and so on, and then they're kind of going into an industry which is more or less unregulated, where they've been asked to maybe care for someone for a half an hour 30 miles away, not even getting basic allowances or recompense. And I think this sort of undermining of the HSE system of home helps that we have is not healthy. And if we're talking about improving governance on healthcare and professionals, that we need to have it at that level as well. And if we're talking about taking payment from people for these services, then the services themselves absolutely have to be under far better footing than maybe they are at present.